So this morning I posted a statement that has gotten a little bit of slack because we're in this mobility craze right now. And the popularity of these slant boards on squats and other exercises have become wicked popular. Now, the only problem is, and you have your knees over toes guy, which take it for what it is. Some people can bring their knee over their toe, some can't, right? You have to look at the structures at play on the individual person, right? So when thinking about the mechanics, well, obviously you have your femur, right? So if I'm coming up, I sort of spin this guy around just a little bit, and I'm bringing that guy up, and this doesn't necessarily hold true to a knee joint because you have all your other structures. But one of the things I want to draw attention to is the simple fact that the condyles aren't the same on both sides. So these are some things we have to consider when we're going into the extreme ranges of knee flexion. So one of the things that'll happen is you'll start putting more stress on the lateral side of the condyle, right? And with sort of meniscal tears on the lateral sides becoming a little bit more prevalent and a little bit more frequent, you have to consider what's going on in the training world that is setting these athletes up for basically meniscal tears on the lateral side. It's less frequent. There's a little bit more mobility within that structure as opposed to the medial side, right? Because the medial side is sort of anchored down to that medial collateral ligament, right? So you just have to be mindful of this. What are we doing as trainers and sport professionals that are increasing the risk of injuries amongst athletes? So just be mindful. If you're taking somebody through this extreme range, right, you're going to start to agitate that lateral meniscus one hell of a lot more. Now, if you start loading that individual like you're doing a squat, that's a ton of sort of downward pressure, right? Because normally speaking, you have your downward compressive forces. And when I go to sort of bend down, you can sort of see how that's going to rock and slide a little bit. And it's going to come down, and the contact surface of the femur on the tibial plateau is going to be reduced. But the forces are going to go up, right? Based off the fact that you're putting stress over a smaller surface area. So those are some things we got to think about, right? Forces over a greater surface area, not so much of an issue. High forces over a smaller surface area, maybe that's the cause of some of these sort of meniscal tears we're seeing. Anyways, have yourself a happy Saturday. Cheers.